I tore my media collateral ligament, not very much, but enough to, when I was playing soccer quite a few years ago, and it caused problems, especially when well, it kind of healed up, and like, if I try to run or go upstairs, or wear heavy boots like in work, and go up ladders, then my knee will swell up and I can't move it. So I went to the doctor and I got an MRI on it, and it didn't. There was damage to the cartilage, and they said there was a cyst in there, which I really think is just where I had re-injuring the same spot all the time, so it's just been ripping and ripping and ripping, and it's created a cyst about a centimeter, or about 8 millimeters in size. And so I went to a doctor, and he says, well, we'll put a kind of a wedge in your foot, a cant there, so that you'll keep that spot wide open so that it won't cause a problem, but or help keep it open so it won't, like when I walk, it won't smash it. But that's I tried that a little bit, but then I was talking to a friend. She was talking about using tape to help support her shoulder, and I thought, well, I can do that for my knee. So, and I did it, and it worked quite well. I can run with my knee now. I can bend my knee, which I couldn't do. It was all swollen before, and it works really quite well. And I just use regular hockey tape. They had the medical tape. I found that actually irritated my skin more than hockey tape. And it's thinner, so it doesn't cover as much surface area on your leg. The glue seems to be, I don't know, for me it doesn't. I'm allergic to different things, and I get reaction to it a little bit, but it's not that bad. I've actually worn tape without changing it for 2, 3 days, 4 days, and it starts getting a little bit funny then. But anyway, so what I do is I bend my knee like that so that my leg is muscles contracted, so that the leg is large in that area. Then I just kind of lightly put a tape around here. The idea is you don't have to make it really tight or anything. You just it's kind of like making a knee brace, but don't have to make this tight. You just let the glue do the work. And get that off, and just let it go loose as it can, and then you can just go like that. And then I put one on the lower part of my knee. The idea is don't have it tight, just have it loose, let the glue do the work, and don't tighten it up, because if you tighten it up, it'll cause more irritation to your skin and so forth. You don't want to do that. You can have lots of wrinkles in it. And then I have like 8 strips here, about 7 or 8 inches long, depending on how you do it. And you put that, like I've got I ripped my inside media collateral ligament somewhere, and probably close to the bone area. I think it's down here actually, where I got my thumb somewhere. Anyway, and then I just go like this, compress the skin as much as you can. Put that down like that. And this is just to stabilize my knee. Press it again. And we'll do, and it really made a difference, like with that knee stabilized. Compress it again. and compress it. Just, oh, let's try it again. I really press it in there. Compress it again. Okay, so we got that nice and tight. Then we got to hold it. So I put a couple strips like this. And like that. On the top, or the bottom of my knee. Yeah, I use hockey tape for a lot of stuff. It's fantastic stuff, really. Besides just the hockey sticks. Anyway, there's that one on the top. And another one. Okay, and then I'm gonna wrap around. That's to hold that other part together. Otherwise, just the stress of that will pull it apart. It's important to make sure that part sticks in good. I gotta flex my knee again here, so that the muscle is contracted and full in size. And that's thin. You gotta make it thick. And then over top of that. And there you have it. And when you stand up on that, it just keeps everything like your ligament's supposed to do. If you, your ligament may not be doing it. Now, it's not bad enough for surgery, but if I didn't do anything, I wouldn't be able to do anything. It would be swollen up and I wouldn't be able to do this. I'd just be able to go like this and it would hurt and it would be all swollen up. It has been, especially when I wear big boots and stuff. And that's it. Thank you for, I hope this helps with any people that have other similar problems. And good luck.